Hi there, Dr. Steve Edlin, and today I want to talk about the 3 different stages of Hashimoto's autoimmunity, talk about your typical medical management and what kind of we do different, how we approach things a little bit, because it's such a diverse, different physiological web of dysfunction, the cause of Hashimoto's. So, and then we'll talk about what, where actually the attack goes to with Hashimoto's and what it looks like a little bit. So here's the 3 different stages. Stage 1 is silent autoimmunity. All right, and that can go on for years and years and years. And that what's happening is you'll have elevated TPO and/or the thyroglobulin antibodies will be positive. You're gonna have no symptoms, and generally no loss of tissue. So how do you know they have that? Because so here's why I like to do the blood work, or comprehensive blood work on everybody that comes in, if they're open to it. Okay, you got to run down to the lab, coronary kind of a pain in the butt, but you know what? It's well worth it. It's a great investment. We can actually see, are you in silent autoimmunity? All right, that's the first one. Stage 1 is silent. Sometimes it can go on for years. Stage 2 is when you get an autoimmune reactivity. So you're going to see elevated antibodies to your thyroid, TPO or TPG antibodies. You're going to have some symptoms. I don't feel good. Classic hypothyroid symptoms. All right. But you might have normal TSH levels. So things are brewing, attack is going on, but your TSH looks good yet. All right. And the third stage of Hashimoto's autoimmune is the autoimmune disease. This is when you have, this is like when they come in, this is late stage. This is when I see people, elevated antibodies with symptoms. You have measurable tissue destruction, elevated TSH. All right, so TSH 0.5 to 4.5. These people come in, they're over 4.5. Most of them may even be on medications, but they never have had the antibodies checked. Have to have the antibodies checked. All right, and that's what happens with the medical model. They don't run the antibodies. So, and generally what happens is they go in, I don't feel good, they got all these overt thyroid symptoms, weight gain, puffiness in the face, hairs falling out, brittle nails, can't lose weight, sleep like crap, tired, fatigue, hands and feet are cold all the time, can't stand winters. I mean, the list goes on and on. So they have overt thyroid symptoms, they tested TSH, oh, it's positive. Diagnosed with hypothyroid, here's your thyroid hormone replacement. Oh, the TSH gets normalized, you're good to go. Check you every 6 months or a year. That's how they manage it, all right? And that can be okay, because you've got to have the TSH has got to be normalized, and it's important to check that, all right? Because you can't manage an autoimmune Hashimoto's if that's not within normal range. So that's an appropriate treatment, but here's the thing. If it's negative, let's say that's negative, generally this would say, well, it might be in your head, give you antidepressants, anti-anxiety medications, oral contraceptives, etc., and you feel like crap too. And here's the thing, you can be on meds and still feel like crap because they're not addressing the underlying immune attack. It's called autoimmunity, all right? So here's the 3 different sites that what happens is the tissue destruction goes to a different pathophysiology of this. So number 1 would be an autoimmune response against the TPO and the thyroglobulin antibody. And number 2 would be an inflammatory downregulation of 5-deiodinase. So what happens, you got to convert T4 to T3, and it happens in peripheral tissues. And with an autoimmune, that can block that, all right? So maybe that's why some of the meds won't work, or you won't feel better after that, because you're not able to convert T4 to T3, okay? And the other one is number 3, where we get thyroid hormone synthesis and Hashimoto's. Number 3, where we get thyroid disruption, is the impaired receptor proteomic response. So the tissues just are, the receptor sites get an immune attack and can't handle the thyroid hormone. So that's where you have to dig deep into this. So here's what I do. What we look into is, what are your triggers? What is triggering your immune system to go haywire? So the most common ones are what? Food, for sure. We know that gluten is something that is going to make this thing worse, all right? But then you have to look at environmental things. Do you have a bacterial infection? that's where, as a functional medicine doctor that works with these kind of issues, you have to start digging deep into cause versus effect. All right? And hey, it's okay to manage it with the meds. I have no problem with that. Keep the TSH under control. Excellent. But if you want to start digging deep into why, even though your labs look normal, you still feel like crap, it's time to start digging deep. So that's where we get into more the lifestyle type of things, diet, relationships, how do you sleep, any environmental things, pathogenic type of things. That's where we get into the functional medicine testing that we do here. So that's a little bit about thyroid and Hashimoto's and the different 3 different phases that you can go through. The most common one is phase 3 because nobody comes in until they get all these crazy symptoms and they've been to 10 different doctors. So a little bit on thyroid autoimmunity for you. Take care. If you like these videos, make sure you ding the hit that little subscription here so we can notify you for future videos. Take care.